So starting off with the shoulder girdle bony landmarks, you have the clavicle, which is right here, the collarbone, and then you have the clavicle end right here toward the clavicle, and then the acromion end toward the, acromial end toward the acromial process. And you have the SC joint, the sternoclavicular joint, it's right in here, kind of like where the bony structure is. And then you have the AC joint, which is where the acromion process and the clavicle meet right here. And then you have the manubrium, which is the upper part right here of the sternum. And then, can you turn around? And then on the back, you have the scapula. And then you have the acromion process right up here, kind of where the shoulder joint meets. And then you have the coracoid process. Can you turn around real quick? It's right here, kind of pokes out right here on the front of the shoulder. And you can turn back around. And then you have the lateral border, which is the lateral side of the scapula, the medial border right in here. And then you have the inferior angle, which is the bottom of the scapula. It's right there. And then you have the spine, which runs right here on the top, kind of top of the scapula. It sticks out, runs like lateral or horizontally. And then, yeah, okay, so now the shoulder joint bony landmarks. So you have the humerus, which is the bone right here. And then we have the head, which goes into the glenoid fossa. It's right in there. You can't really touch it, but. And then we have the deltoid tuberosity, which is kind of like right here laterally near the head. And then we have the greater tubercle, which is right around here. It's kind of hard to feel all of them because they're kind of near each other. And then the lesser tubercle is also like right below that, near that. And then you have the intraventricular groove, which runs kind of like halfway down right here. And then we have the neck, which is more on the inside right here. Okay, so here's the shoulder joint musculature, starting off with the deltoid. It's kind of like on your shoulder, and it runs a little bit to your backside. And the anterior portion does shoulder flexion. The lateral portion does abduction of arm, which should be like that. And then the posterior portion does shoulder extension. So then we have pectoralis major. It runs here, your pec muscle, and then it connects to your humerus. And the upper fibers do flexion of the humerus, and the lower fibers do extension and adduction. So then we have the latissimus dorsi. These are your lats. The kind of big muscle that runs like right through here. And they do extension of the humerus and abduction and medial rotation. And then you have teres minor, which kind of like runs on the lower part of the scapula right here. It's under your lats. And that does extension of humerus and abduction and medial rotation. And then you have your coracobrachialis, and this runs on the front side from your coracoid process here onto your humerus. So, it would run like right down here. And that does flexion of the humerus and abduction of humerus, or adduction, sorry. Okay, so here's the shoulder girdle muscles. Starting off with the serratus anterior, it's the lateral part of your ribs. And when they're developed, those are the ones that kind of look like gills. They protract the scapula and do upward rotation of the scapula. And then we have the pectoralis minor, which is under the major, and it goes from here, and then it connects to your coracoid process, and that protracts and depresses the scapula. Then you have your subclavius, which is under the clavicle, and that depresses the clavicle. And then you have your trapezius, which is on your back, and they're the trapezoid-shaped muscles, or I guess muscle. And the upper fibers elevate the scapula, so up. The middle fibers retract the scapula, and then the lower fibers depress the scapula, so that goes down. And you have your rhomboids, which are under the trapezius, and the major retract the scapula and do downward rotation, and then the minor rhomboids retract the scapula as well, and also stabilize the scapula. And then you have your levator scapulae, which are known as your traps. So these are the muscles that run all up here. And those elevate the scapula and do downward rotation of the scapula.